how many students does apply every year for USMLE from India?
Pretty much out of 150, almost half of the students are trying to do USMLE.
Is that so? Let's welcome Dr. Parth. He is into the field of teaching for USMLE since last 7 years in USA. Indian doctors doesn't get a surgical residency program.
They trust the minds coming from outside US.
Right.
They're not trusting the hands coming
Right.
out from outside US. In terms of US system, from day one, they are going to ask you multiple choice questions. Here, the problem is maybe they ask a complication of cirrhosis and then you can list 5 and then not worry about the other 4 and then the examiner won't check that. When it comes to NEET PG now, they are digging up those with multiple choice.
So what is the structure of USMLE and all? How USMLE examinations have scoring system? Do you get any advantage if you have done good research papers from India? Is that true that in step 2 examinations you have only one attempt? If someone have cleared all the step 1, step 2 and he didn't match unfortunately, what are the other ways to practice as a doctor over there? What would be the fee structure? If you are preparing for step 1, then you are confined to such these 3 or 4 subjects only, or you are supposed to read everything?
The system in US is mostly about like everything together.
Namaskar, welcome to Unfiltered Facts with Dr. Ravi Prajapati. Since last 2 weeks, I am getting so many messages on Instagram. If I can call someone to educate how to apply for USMLE, how to pursue their PG in USA, and I have asked a very dear friend of mine to join us for this conversation. He is into the field of teaching for USMLE since last 7 years. Let's welcome Dr. Parth. Hi.
Thank you. Thank you for having me.
After a very long time.
I know.
See, what this is our structure of the talk. Okay. We start with the childhood things. If whether you have had any inspirational memories which leads to the dream of becoming a doctor or wherever you are right now. So, if you can please explain how was your journey from your childhood to becoming a successful doctor?
Sure. So I'm the youngest of 4. I have 3 elder sisters, and I was like kind of the favorite child for my parents and my sisters. So when I was growing up, I had my mother going through tough health conditions and almost like twice, thrice near-death experiences. So that made me look at doctors in a different light. And I started thinking about becoming a doctor, pursued it in like the 12th grade with proper examination scores and stuff. After that, or while that was happening, I also kind of got inspired by my grandfather being a high school teacher. So this was kind of a perfect combination of serving people by becoming a doctor and also having that genetic kind of component.
Academic genetic.
Exactly, right? So this is kind of a perfect flow.
Right. And if I'm not wrong, you got the highest in Gujarat entrance test from Ahmedabad, right? You got the highest score.
For in our time, there used to be an exam called Gujket.
Gujket, yeah.
And we were the first guinea pigs for that.
Definitely.
And I think, so I got like the highest score for the B group for that.
Right.
And that's kind of pushed me to be in NHL in Ahmedabad. Otherwise, I was not going to make it in Ahmedabad for like the merit system we had back then. I had it, in my mind, very clear that, okay, I'm not going to go through any like payment options and stuff. So that exam made me kind of push through that. And I'm kind of teaching now, similar exam in a different country.
Right.
Yeah.
So what is the structure of USMLE and all? If someone wants to understand that whether he or she should apply for USMLE, what things they need to take care or how they need to prepare. So an overall perspective
Hmm.
for USMLE.
Correct.
If you can please explain.
Sure. So USMLE is basically US medical licensing exam, right? So if you want to put it in perspective to an exam closest to something in India, it would be NEET PG. But the difference is there is not just one exam. There are three exams. Two of them you take. So these are called steps, right? So USMLE is step 1, 2, 3. The two of the three steps you take during med school.
Oh.
If you are a US student, if you are IMG, so if you are an international medical graduate, right? So then most of the students are taking it after graduation. But now the new culture is take some of the exams during your third year, fourth year, and then get a heads up, right? So like you are taking those exams to either as a US grad or US medical student get licensed to be into a PG, or there you call it residency. And then the third step is what will determine if you get the license to practice on your own. So that step, as a outside US or IMG, you can take the third step as soon as you graduate from your med school here or Russia or wherever you are from.
Right.
But in US graduate system, as soon as you graduate, you pretty much are into residency right away. So you don't get time to do that third step. So most of the US grads will take that exam during their residency, which may be 3 years or 5 years, depending on what field they are going into.
Right.
And that third step would be sponsored by their residency program or the hospital.
Right.
Yeah.
Right.
So those are the three different steps in like when you take it. In terms of what they are, step one is more into basic science, right? So let's say tuberculosis is very common in India. It's very like getting more prevalent in US also nowadays. So step one would ask a question about, oh, if you see some granuloma on, like the bronchial lavage, and then now you are thinking about what is the diagnosis, right? Or
Right.
you do a PPD test, quantiferon gamma test, and something comes positive. What is that? So diagnosis questions are mainly step one questions.
Right. So there is no subject restrictions or anything that you need to prepare for. If you are preparing for step one, then you are confined to such these 3 or 4 subjects only, or you are supposed to read everything.
No. So the system in US is mostly about like it's everything together, right? So step one is mostly basic sciences, which will focus more on like pathology, pharmacology, micro anatomy, biochemistry. So the first 2 years we
First
learn
2 years
here
of India,
is
right?
pretty much there the same thing. But in India we learn it mostly subject based, so like anatomy, biochemistry, this and that. Most of the US schools are going towards more multi-system approach, where they will go, instead of going from like discipline to discipline, they'll go, okay, let's do cardio, but then anatomy, physiology, farm path of cardio, and then the next few months they'll learn pulmonary.
The systems.
Correct, right. So it depends on different schools in US also, but that's how it is. So step one will more focus on the basics. Step two would be like, okay, that same patient of tuberculosis, they'll be asking, okay, you did diagnose, or they'll ask, this patient has this weight loss and fatigue for 6 months, and now they are asking how do you prove it, or what is the next step in management. If they are coming to you with active symptoms, then your answer would be isolation. If they are caught something on the chest x-ray, then you treat them without isolation, right? So that management aspect is step two. And then step three would be, you are the person in charge, like in Indian terms would be medical officer, right? So you are already treating the patient or dealing with stabilizing the patient. And then step three would ask about, you already treated the patient and something went wrong, or something didn't work, or something got improved. Now what do you do, right? So like, oh, patient comes 2 months later, the x-ray is clear, the sputum is clear. Now what? So you have to kind of think about the next step. So that's why step 1, then next step 2, step 3.
Right.
That's how it works, right?
So starting from the basic to managing the complications.
Yes,
The whole
but
process.
correct. But when I remember me taking step 3 or me teaching step 3, you will also see questions about diagnosis because they always want you to go back to the basics, even if you are a resident or like graduate,
Right.
So it's kind of like they want you to be in that multi-system.
So that is true. See, basics is very, very important. It is the core of any practice. If basics is not clear, it is not strong, then you cannot even practice in your actual practicing days.
Correct.
You cannot. This is what I say always whenever any juniors come to me. I say never forget basics. Because whenever I treat patient for orthopedics, I cannot just direct jump to the okay, let's do the plating, right? So the basics are very clear. You need to wait till your swelling subsides. If patient is comfortable, alignment is good, then you can put plaster. So you just don't need to jump into the out of the blue things all the time.
Exactly.
Very true. Basics is very important whenever in any kind of examination. If I say
Absolutely.
right.
Yeah. So that's what I also talk to the students I come across. So in last 7 years, just the ballpark figure, probably I interacted one-on-one with maybe more than 10,000 students from everywhere in the world. So what I tell each and everyone is, if you are going to be able to just explain in layman term to your parents or your sister who have no clue about medicine, just simple terminology without any medical jargon,
Right.
then if you're able to do that and also answer follow-ups in that simple language, that means your basics are clear. If you have memorized something and you are just having a verbal diarrhea of that, then the patient would nod, but they are not going to be satisfied because they didn't understand, right?
Right.
So that's the important part. And I think the system of USMLE is specifically now, since a lot of outside US students are applying and pushing to get into US medical system, they are making the bar go higher and higher
Right.
every year.
So it is not just mugging up.
Oh no.
So it's a multidisciplinary thing. You need to have good communication skill.
Correct.
Right. See,
Yes.
good communication skill is one of the many skills you will have to work on it. Right.
Yeah. So the mugging up part, because I did MBBS here with you in NHL, right? And I know that, okay, there are certain exams we just went through, whatever the most important things our seniors told us, and then went in the next day and were able to just perform okay, right?
Yeah. Very true.
Right. But then what will happen in USMLE style exam is there is no essay writing. So there is a drastic shift of how they're asking questions. It's a multiple choice question throughout, and they give you like a patient case, sometimes like 4 lines, sometimes the full page of like 20 lines, and then you have to kind of decipher what's going on very quickly, and then answer a multiple choice question, which is very sometimes they are kind of putting very similar answers together and stuff, right? So you can't just be asked like, 10 points for complications of cystic fibrosis. That won't be a question, right?
Right.
They will give you a patient of all the symptoms of cystic fibrosis without telling you this is cystic fibrosis. And then they are going to ask, okay, the most likely medication we are going to give has what mechanism? So the whole thing is mystery. If you didn't decipher the first part, you are not going to come to the last conclusion.
Right.
So the mugging up part is important of like, oh yes, if you know what drug they're talking about, then what is the mechanism? That mugging up needs to be done, right? So our like my South Asian students, Indian students who are great at that, they have that comfort about like, like pneumonia after viral infection, I'm thinking Staph aureus. That they have very quickly, right?
Right.
But to come to that conclusion, sometimes the whole story and deciphering the story, sometimes they struggle with that.
So, if you have done your MBBS from India, you need to change your perspective of looking towards the medicine and the looking at the answers of any questions. So that might help.
Yeah, so the biggest difference I felt personally when I went through the journey here as a medical student and there as an instructor or taking exam myself was that very heavy in India on essay writing, right? Like the whole 5 years, 5.5 years we spent mostly in exams and prep is mostly on essay writing style, right? Like they are going to give you a question and then you can kind of verbalize in your own way.
Right.
And then maybe if your handwritings are good, that might also help for like,
True.
so, but in terms of US system, it's different because from day one they are going to ask you multiple choice question throughout. There's no essay writing. There's nothing like that.
Right.
Here the problem is, let's say you are doing that essay writing style and thinking process. Maybe they ask a complication of cirrhosis, and then you can list 5 and then not worry about the other 4, and then the examiner won't check that because they're like, oh, there are 5, that's enough, give like 4 out of 5 and move on, right? But then when it comes to NEET PG now, they are digging up those with multiple choice and like, hey, why internal hemorrhoids happen in cirrhosis? And then they're asking that now. But in USMLE, they ask from day one. So the perspective needs to be changed a little bit because there is a significant difference between mugging up the clues and pushing yourself to think conceptually. So if you're thinking conceptually, you are going to be having easy time with USMLE. If you're great at mugging up, it will help, but at some point you will struggle there. Yeah.
Right. So, if you can please explain how a USMLE Step 1 examinations have a scoring system or whatever it is, if you can please explain.
Sure. So USMLE step 1 is pretty much 8-hour exam. They will have 40 question in 1 hour, and there are 7 of them, and there is 1 hour break you can split. So that's a 8-hour window continuously, right?
Right.
So that's the first challenge, right? Like most of the exams here in most of the countries would be like 3-4 hours, maybe 5 hours. This is a long exam. So you have to be good with stamina. The second thing is the scoring used to be maybe like four years ago, used to be like out of like 280, 290, and then how much you score. Now, I think the theory from the US medical system was let's take away the burden from the students and just put pass and fail. So now the exam since like last 3 years, I think, is pass or fail, right? So in my personal experience, that actually has enhanced the stress a little bit because you now are relying on the other exams to have a good score. So like your stress is kind of shifted from step 1 to step 2. And that's a much worse situation to be in because when you're doing step 2, you are close to application in the match for residency, you are close to graduation. If you are Indian student, you are close to doing internship, which might be busy.
Right.
So before there used to be 2 or at least 2 exams where you can show your worth. Now there's only 1 exam because everybody who did step 1 and are doing step 2 have a pass tag. So like even if the person passed with the bare minimum or they had a 99th percentile, there is no way to know. And there is no report of that. I mean, there would be a standard deviation graph given to you as a student, but that is not shown to any of the residency programs. So nobody can see that. So like the person who is looking at your application would only know you passed step 1 and that's it. So that's a little bit hard, but that's what it is. There are ways to kind of check or judge where you stand as a student by doing NBME exams, right? So that's National Board of Medical Education, which conducts USMLE, but they have practice exams, at least like 6-7 of them for step 1, 5 or 6 for step 2. So you can check your scores there, and if the score is like maybe a standard deviation above passing, then you know that okay, you are in safe zone. right? But there's pass and fail right now for step 1.
Right.
Yeah.
And scoring system for step 2?
Step 2 still has scores. So, like, again, you go generally out of 280, 290. There is no real data on exactly how they score, but the theory most of the instructors or most of the schools have is there is a peer comparison based scoring, right? So, let's say a question is got wrong by most of your peers who took the exam that year or that window. Then you don't get punished for that question too much. But if you get a question wrong for like answer wrong for some one question which everybody got right, like, and then like mosquito bite, having like fever on and off, like you have to think malaria, and if you didn't think malaria and you didn't click that, you will get punished on the score, right? So that's the scoring part theory. There is no actual data on like there's no 1 point for one question pretty much. But then the other part is out of those 280, 290 highest scores, generally for step 2 right now I think is 214 passing.
Okay.
It used to be 193, 196. So in like last 6 years, they have increased the score pretty much every 2 years in terms of passing,
Right.
which shows me as an instructor that there are more and more people interested in coming in that market.
Right.
And that's why there's more competition, I guess.
Right. So, as per your experience, how many students does apply every year to for USMLE from India?
I don't have the data for the total number, but I can tell you, like, from my experience in terms of just like purely the students I interact with, right? So like generally every 5 weeks where I teach, there is like general like maybe 120, 150 students, both combination of in person and online. And then out of that, I would say like 15-20% are Indian origin. Either they were born in US and went to India for med school to save some years,
Right.
or they are just from India and then they are trying to pursue to come here. So I would probably say there is a big chunk. Like if I check NHL, right, like out of 150 students we had back in time, there were at least like 30 students who
30
were
students,
trying,
yeah,
right?
true.
Now I was talking to one of the NHL student like a few weeks back, and pretty much out of 150, almost half of the students are trying to do USMLE.
Is that so?
Yeah, so because there is a dynamic shift about okay, how many med schools are merit based, how many are payment, how people having more resources, they would want the kids to go out and have maybe better chance in other countries, especially US medical system.
Right.
So maybe that's kind of contributing to this. But I would say there is a big chunk, there's a lot more increase compared to, well, let's say 10 years ago.
Right.
Yeah.
So, once you have cleared step 2, right? So, what would be the next process?
So when you are, I mean, right now, since COVID, they have stopped taking step 2 CS. So step 2 used to have two parts: clinical knowledge, CK, and clinical skills, CS. They removed CS because that involved having standardized patients or actors
Right.
kind of interact with you, and then you have to perform physical exam and all that. So
Like
they removed,
Viva, practical examinations.
but it would be done just by recording you and
Okay.
stuff, and then the patient in the room is actually just an actor.
Right.
They are not examining you, but somebody is watching you and examining, I mean, scoring you, right? So that part is not being examined right now. They are in talks of bringing it back maybe in few years. Right now it's not the case. So maybe if somebody is trying to get into the system, they should do it like in next few years before the exam comes back.
Right.
But yes, so after step 2, you get ECFMG certified, right? So that's basically a unit which will accredit your school's diploma or the degree you have by contacting your med school.
Right.
And kind of verifying that yes, this is not a scamming student, this is actually a student who went there and all that. So your dean would write a dean's letter or MSPE, which is like medical school performance eval or evaluation, and then that would be submitted to that entity, and then you also submit the 2 scores you have, and once you have that, they will provide you with the certificate, which is saying that okay, you are pretty much now equivalent to a US medical grad on paper,
Right.
And then once you have that ECFMG certification, that's pretty much like the baseline of you able to get into the residency there,
Right.
The only difference compared to US system in that way is it's not just the exam based PG, right? So like here, let's say you are scoring in the top fifth percentile, or like like 95th percentile or above, then you can pretty much choose. Doesn't matter who you are, what your personal skills are, as long as your examination skills are in the top fifth percentile, you are able to say, okay, I want radiology here, or I want to go to orthopedics in Ames or something, just because you performed better.
Depend on your score.
Correct.
Right.
Purely on score. In US, you can perform as much as you want to, which is a big criteria, obviously.
Right.
But once you perform, there is always going to be an interview, right? So, like, let's say a person scores a 270 out of 280, 290 highest score, then on paper, that's a great person, right? He or she can go in India somewhere and be like, hey, I have like really top tier score.
Right.
I can go into any PG program which has that merit. But in US, everybody who has that cutoff maybe is selected for a one-on-one interview.
Right.
And that interview shows the program whether the candidate has a personal skill or a team, like a team player vibes, right?
Right.
And then that's how kind of they decide whether they want to take them, right? Sometimes a student or a medical professional can be socially awkward, or they don't have the skills to interact. And then the program is pretty much family medicine, which requires a significant interaction with the patient on daily basis. So if you are not able to perform a proper interview with the program director or the fellow residents who are senior to you, that means they see that, oh, how are you going to do that every day with patients? So they are going to reject you even if on paper your score is great.
Okay.
Right? And that can go in favor of you, that you have a lower score, but you are able to communicate with them either by
You have an excellent communication skill then.
so then they will prefer you because they see, oh, I mean, knowledge-wise, they can train you. But in terms of your skills, they can't pretty much.
Personal skills takes time.
Exactly.
Yeah,
right?
very true. Very true.
So that's kind of a good point or a bad point depending on who you are as a person, rather than a test taker.
True. Yeah. So I have heard from so many students that Indian doctors doesn't get a surgical residency program. Is that true?
That's not true, because there are so many programs who do take that like into consideration about US grads getting there, but the process is longer. So you are not going to get directly into surgical program as you do get into like internal medicine or family medicine programs, because they don't trust, they trust the minds coming from outside US. They're not trusting the hands coming out from outside US. So they want you to actually work with them for months, maybe the whole year, before they'll be like, okay, let's join, right? So for surgical candidates, I think the best advice I have is do the exams, that's fine, but you have to show your manual skills. If you are showing your manual skills, they are going to accept you. But that's the hurdle, because in other branches, generally the skill is more from here rather than your hands.
Right.
So that's the hurdle which is hard to cross, because most of the students coming from, let's say, India would prefer to get into some kind of residency as quickly as possible and then start earning and
But see, in India, we get good hands-on patients even during our internship time. So if whoever wants to do surgical program, they should uh, work hard during internship, or
Yeah.
that won't work.
No, it would work if you have a good rec letters from here, like surgical faculties from here. The concern most of the surgical programs there have, like in US have, is they feel there is a significant difference in terms of the protocols we follow
Right, and
in a
surgical protocols, yeah.
versus in US, right? So like that's why they're like, okay, like they want you to show them your ability with hands and with a team.
And with their protocol.
Correct, right? So that
Right.
once you do that for a few months, there is a scope there. And believe me, like even a surgical candidate from a US med school have still hard time getting in for the same reasons.
Right.
So like a surgical candidate would be asked about like, hey, what you did for your fourth year? Because fourth year in US is audition year. So like you can choose like, okay, I just want to do let's say somebody wants to go into ortho. They can choose to do like 7 months of orthopedics in their fourth year of med school and show back and again and again to different programs that hey, look, this is what I am. In the beginning they might learn and then later they can show what they learned. And if they didn't do that, they would still be rejected in the interview system and they have to kind of fall back. So like most of the surgical candidates who come for the exam with me, they will always have like a backup application. So like they'll apply to surgery, maybe ophthal, general surgery, orthopedics as first choice, but they'll always have a second choice of like some medicine, that like internal med, family med as their backup.
Right.
So just in case the first one doesn't work out. Yeah.
But if you want to become a surgeon, then you need to work hard.
Well, I think that's true for most of the field. But yeah, like mechanically, I guess like you have to be there.
Do you get any advantage if you have done a good research papers from India when you are in your UG days, or is it really helpful?
So yes and no. So depending on what field you're applying, right? So internal medicine, yes, it does help because let's say they call two candidates, right? Both of them pass step one. Both of them have a 230, 240 score on step two.
Right.
Both of them, like are fresh grads. So like they haven't haven't had a drop year between their graduation and application. So everything on paper is similar, right? Both of them are multilingual, whatever, right? So then what differentiate one from the other? One has a research maybe in specific field where they are applying, or maybe they kind of research already about what program they want and then they kind of know the program director's interest subjects and they research something here on that particular topic and then they are showing something there, right? And that would kind of give them an edge about like just a perception of like both are coming for the interview but one has something more to talk about because the interview taker has similar interest as what you researched in. So that helps you, right?
Right.
So, and also on the application of the match, which is basically the residency application system, there is a section for like research publication, which is separate than your medical performance, medical school performance.
Right.
So that at least to just have a filler, something would be helpful.
Right.
Yeah.
And is it true that to get a good letter of recommendation, it is very hard to get good letter of recommendation in US? Is that true? Or whether the LOR works or not?
Of course, there is a significant impact from LOR into your application, especially since they put step one as pass and fail. Remember, I told you that before step one used to be the key point for any application,
Right.
and step two would be the kind of like cherry on the cake. Now, step two is the sole performance kind of eval you can show. So then, what else they can see in your application, which will tell them whether this candidate had the ability to work with somebody, impress them, right? So having a good LOR from your school definitely puts you on the edge about somebody who is applying with you. Yes, having LOR from India would be less helpful compared to working in your intern year and going there for an externship and getting an LOR from there.
Right.
Because they want an LOR from somebody who is in the system there, maybe from a program director, associate PD, somebody who knows what to see in a candidate, because they are actually the one sitting on the other side of the
Right.
table, and then they are saying good things about you. That means somebody else reading that, they know that, okay, if the recruiter is telling me that this is a good candidate for him or her, that means I should consider this
Right.
person. Yeah, so LOR is significant for like 100%. So getting a good LOR is some like your second priority after performing good on your exams. It's not hard to get LOR, but yes, if you are just going there for like 15 days and you want 2 LORs, or you're going for 1 month and you want all 3 LORs, it would be hard because a person who is writing something, they are putting their neck out for you.
Right.
So they are not going to put something very specific about you because they haven't seen you enough, right?
Right.
They are going to put something generic, which they put for all the candidates who ask for LOR. But if they work with you and if they kind of saw you doing CPR on somebody and they're like, oh, that person was involved with me in my team doing this, and they saw something in you, they will write that. Or you can remind them that, hey, remember Dr. So-and-so, I worked with you and we did this case of gunshot wound, and so they will remember and they'll probably help you with that, right?
Right.
So 100% LOR is very important, since now step one is pass and fail.
Right. And whatever is written in the LOR, it is more important.
Yes, so in terms of reading something from your application, the first thing they'll read would be the MSP, which is the medical school performance evaluation, which comes from your school,
Right.
which is basically throughout your 4 year of med school, where were you compared to your class, right? So that's your dean's letter for like terms in US. So dean's letter or MSP would be the first thing they'll read. The second thing would be the LOR, right? And then somewhere in that, they'll also read your personal statement, which is like, how are you selling yourself?
Is that true that in step 2 examinations, you have only one attempt?
No, so you can have attempts. Like now they have rules of 4 attempts total in all the exams, or 2 max attempts in individual exams. But if you clear the exam and you have a passing score but a very low score, that's with you for the next 7 years. So
Right.
most of the candidates won't pursue to take that again, waiting 7 years, right? So if you pass the exam, then that's your score, pretty much, practically speaking.
Right.
If you didn't pass the exam for whatever reason, then you still have a chance to do it again.
Right. So 4 attempts are
So it depends on different states now, but on an average, just the main idea is 4 attempts total in all the exams.
okay.
Yeah.
Right. So now let's talk. If someone have cleared all the step 1, step 2, okay, and he didn't match, unfortunately. So what are the other ways to practice as a doctor over there?
Great question, right? So, I mean, he or she shouldn't get disappointed because there are more options. So, like, the first thing is the match kind of comes first is, did you match or not? That's the email you'll get.
Right.
If you didn't match, that means you're eligible for SOAP, which is kind of reshuffling, right? Or it's about some programs who didn't feel like fulfill their seats, and there are some candidates who never didn't match anywhere.
Right.
So they are trying to kind of put them together. In generally, it's like four days worth of kind of back and forth. So you would have a chance of doing like a quick interviews in next 3 days, and every day they will give you an answer about, oh, are we taking you or not, right? So there would be programs who are still looking for candidates because nobody matched to their program, or they rejected many students or physicians thinking there more would come, but they didn't get that.
Right.
And then there's students who never applied there, right? So that soap or kind of matching that would happen in next 4 days before the final results come. So I think Monday match or no match comes, and then the next 3-4 days you would have this opportunity of quick interviews via Zoom or video calls, and then by Friday they will have a result of where you match, right?
Right.
So that's the first thing you should do without becoming disappointed. The second thing is, so obviously if the soap also didn't work for you, there are other options, because there are programs who are taking candidates outside the national registry of match, so the match which happens through the official system, right? The good part about that is the US grads, so AMGs, American medical grads, cannot go through that system. They have to go through the match.
Right.
So if you are outsider or you are graduated from outside US for med school, you have opportunity to go contact the hospitals who are kind of taking candidates like that directly, and then you can still work with them and get matched there, right? So that's another thing. But the issue with that is you have to kind of research and find those programs by yourself, or maybe word of mouth from your seniors who did something like that, right? So that's the third thing. I mean, the second thing. Beyond that, obviously, if that didn't work out, the best option you have is actually working somewhere for that extra 6 months or 1 year before this next cycle starts. So you will basically going to show your face, show who you are. And sometimes the programs only need that, because the biggest reason of somebody not matching might be, oh, the scores are not up to par or something. But then if the program sees who you are for a few months, the score doesn't matter, because they see you working with the nurses, with the other residents already.
Right.
And if they see that for a few months, they are going to offer you a courtesy interview, or maybe they'll say that, oh, yes, just apply here and we'll take you, right?
Right.
So that's another thing. It takes more patience, obviously, because now you are kind of behind in terms of the process, but that's an option. Now, while you are doing that, some states, like I know New York has that, is they have a limited physician license also. So they are called LPs.
Right.
So basically, you are going to work under a physician who is doing the work of signing something, but you are doing the work under them, right? So you are not going to get paid hefty amount, but you are going to get paid enough to have both your basics kind of fulfilled in terms of your expenses, your family and stuff, and then you are gaining clinical experience while working, which will help you for the next cycle.
Right.
Right? So that's something you can definitely think of.
Right.
So that's definitely there. And to kind of reiterate the point, I personally know so many friends and students who I work with who are American grads. It's rare, but they do face similar things where they probably had bad day on the exam and they failed. Maybe they had a panic attack and they didn't finish the exam, something like that, and they are struggling with something like this. They have a family issue and they took leave of absence, and that's bothering their application. They still are able to kind of get into the system or break this barrier few years later, right? So it's not just that outside, like IMGs have this issue, AMGs also have this issue, maybe in less percentage, right? So there are ways to kind of break through that. And if you think about an average age of first year resident in US would be almost 29-30 year old, versus somebody who is freshly graduated from India would have the average age of 25 maybe, right? So if you think in that sense, like you are still way ahead of other people practicing around you, right? It's just that because you left India and now it feels as if you are behind, right?
Right.
Yeah. The fourth option I can actually think of is uh, you can feel like feel the gap of why like you applied second time or something like that by filling a degree like MHA, MPH, right? So public health masters or master of health administration. And what that will do is it will have a degree attached to your name, and it is also exposing you to some clinical experience opportunity and something which is adding on top of your already existing application for the next cycle. So that's an opportunity, and then that gives you two things. You can kind of pursue the degree while you are still applying the next cycle. If the cycle works out, that's great. Otherwise, you can still pursue that degree and have a job which is research based, right? There are a lot of students who kind of do that, like they do MPH and kind of go through the research route, or they are a good amount, and they are dealing with the clinical side in the public health department through that system also. Yeah.
So one last question, Dr. Parth. What would be the fee structure for the USMLE, the whole process? And if somebody wants to have a good tuitions, we can say, or a good lecture series from online or anywhere. So how much does it cost on an average to to actually clear till step 2? After step 2, you are at your own, right?
Yeah, so there are two things which we have to consider. One is the application cost of like all the papers you get from your school. There is an identification form which might like cost you around $200 to kind of get the whole process started. But the actual exams cost like around 800-900 each, right? Roughly. Maybe they might have changed the price of step 3, which is like maybe 1,000 or around that. But that's so those are probably the costs. So let's say $3,000 for the exam. There is a fee attached to the application part, which is for the match. So tentatively, depending on how many programs you apply, if you have a good solid application, you might apply to less programs and your expense is less.
Right.
But on an average, $3,000 to $5,000 is what you need for that application process, right? So like $3,000 for maybe the exam fees and the application there, and the match would be $3,000 to $5,000 there. Now, some students are gifted, and then they can kind of understand the system. They're able to transform their clues into concepts easily, and they're thinking more in that other conceptual, system. But if you are not able to do that, then you probably need somebody to guide, right? And most of the programs are now, since COVID, like I myself would have that where I was pretty much doing more in person teaching before COVID, and the COVID kind of pushed us switch that, right? So like that now is like, okay, if I have, let's say 120, 130 class in every 1 or 2 months, majority is online, right? Like 40 in person and rest of them online. So there are students who are, doing it from India, Austria, Russia, everywhere. The online classes are cheaper, obviously, because there's no overhead. But sometimes the engagement is less. But obviously, if you have visa issue and stuff, then that's the best option. Online probably would run for the 5 weeks of just lecture series for maybe step 1, step 2. Any of them would run maybe around like 2,000, 3,000. And then if you're in person, it might be 4,000 to 5,000.
Right.
So that's the cost you have there. And the question banks you get, so the practice material, that might be around like $2,000 on average. So 1 or 2,000. So you're looking at close to 14,000, 15,000 expense
Right.
for the process. if everything goes according to plan.
Yeah. Thank you so much, Dr. Parth. I guess I think we have covered almost everything, and our viewers should get their answers from this. And if in case any of our doctor friend wants to connect with you, if you allow me, I will put your email at the end of the
Definitely.
talk.
Yeah.
Thank you so much.
Thank you.
Thank you.
Thank you for having me.
Thank you.